So we'll open the floor for, we have a few minutes. That's the first discussion. So feel free to come to the mics if you want. So I have, the first question is probably for Professor Shafiq and Dr. Al-Maskari. Is there a genetic component for dry eye disease? Any genetic component for dry eye disease?
Yes. To my knowledge, up till now, they didn't define any gene who governed that. But I believe that the majority of the autoimmune disorders are governed by genes. This will be new in the pipeline. So far that we are now marking some biomarkers. So we know very well that the biomarkers are deeply attached to the genes. So in a way, there will be a genetic component in the very near future.
I have another question about the PRP that you mentioned. Now, if you compare that to autologous serum tears, like would you prefer one versus the other? What's the advantage and disadvantage of using either or?
Yes, actually I use PRP in the advanced cases, especially the Sjögren syndrome, both primary and secondary. When you have an epithelial defect and epithelial death and the component of the epithelial part of the tear film is really damaged, the epithelial damage, the PRP is much more helpful because of the nerve growth factors and the multitude of growth factors. Because if you try both of them, you will find a real advantage of using PRP. And if you start to use it intra-lacrimal gland or even in a subconjunctival, in the inferior fornix, subconjunctival injection, you will find a tremendous results faster than the use of the autologous serum. I might use the PRP at the beginning to introduce the wow effect, and then I might maintain with the autologous serum.
Okay, that's great.